So we do lots and lots of body contouring with 360 liposuction and Brazilian butt lift. And a lot of patients are asking, how much fat do I need for a BBL? And, really the answer is, I guess it depends on your body. But typically in liposuction, we're gonna do what's called a 360 liposuction, which is multi-site. So abdomen, back, waist, arms, thighs, etc. Whatever area needs to be included to get the shape lean in that nice feminine hourglass shape. And then Brazilian butt lift is really to fill the buttocks so that we can accentuate that fuller part of the hourglass. And I always liken it to patients that, it's like blowing up a balloon that's lost some air. We're not trying to create this huge butt. We're trying to, if the butt is a little bit weak or deflated, fill that with fat so we can pop that curve out to get that round and firm top to bottom and side to side. Average volumes for that, depending on smaller, thinner patients, maybe 350 cc's. Bigger, taller, heavier patients, maybe up to 800 cc's. So it really depends on someone's body. But even in our thin patients, the skinny BBL type of people, generally, they've got a little bit of fat in the common places. And then in those kind of body frames, we usually don't need all that much fat for a BBL. So, you might be surprised about which people are candidates, even though they're rather thin. If you're too thin for a BBL, it's not an option. Butt implants are the only other real option that's safe. And if that's a problem, it's not the worst problem to have in the world if you're too skinny. So any other questions on this or other things, feel free to contact us and we're happy to answer those.